the world faces a serious risk of undoing decades of progress in the fight against HIV/AIDS. The withdrawal of the United States from global HIV/AIDS initiatives is not just a political decision, it is a crisis that threatens millions of lives. Without immediate action, the consequences will be devastating: rising infection rates, preventable deaths, and a resurgence of an epidemic that had been largely contained. The decision to cut funding for international HIV programs undermines public health on a global scale, as epidemics do not respect national borders. One of the most alarming aspects of this situation is the direct impact on those who depend on life-saving HIV treatment. The U.S. has played a crucial role in funding programs like PEPFAR and the Global Fund, supporting treatment for nearly half of all people living with HIV worldwide. Now, many clinics are closing, staff are being laid off, and patients are losing access to essential medication. The consequences are immediate and deadly. People are already dying due to treatment interruptions, and drug resistance is becoming an increasing risk. If nothing changes, projections indicate that millions more will suffer in the coming years. Beyond the humanitarian crisis, the economic and social costs of inaction will be severe. A resurgence of HIV/AIDS will place an enormous burden on healthcare systems, particularly in low-income countries where resources are already stretched thin. Moreover, the loss of progress will not be limited to health alone. Education, economic stability, and entire communities will be affected as HIV/AIDS disproportionately impacts vulnerable populations, including young women, LGBTQ+ individuals, and marginalized groups. The world cannot afford to turn its back on these communities at such a critical moment. The international response so far has been dangerously slow and inadequate. While some European leaders have acknowledged the urgency of the situation, no concrete commitments have been made to fully replace the lost U.S. funding. Countries like Germany and Austria must take stronger leadership roles, but even their contributions will not be enough unless a broader global effort is organized. Without a new strategy for funding and coordinating HIV prevention and treatment, the world risks falling decades behind in the fight against the virus. The upcoming Global Fund financing round is a crucial opportunity to address this crisis. However, without the U.S., the funding gap will be nearly impossible to fill. The failure to act now would not only be a betrayal of past efforts, but also a moral failure of the international community. The tools to prevent and treat HIV/AIDS exist, but without political will, they will not reach those who need them. A reversal of progress is not just possible, it is already happening. The question is no longer whether the world can afford to invest in the fight against HIV/AIDS, but whether it can afford not to.